Nurse Iram Chogala grapples with difficult questions every day as Ontario's hospitals buckle under incredible strain.
How many staff are working today? Or are we going to have enough beds for our patients today? How bad is it going to be today?
Some hospitals are struggling to even stay open. An ICU in Bowmanville near Toronto is closing indefinitely. The Ontario Nurses Association says 14 hospitals will be operating at reduced capacity this long weekend.
Senior citizens, pregnant women, children will remain on an ER gurney for 2 to 3 days, awaiting their admission to hospital.
The crisis healthcare workers say is being driven by a lack of beds and a lack of nurses. Systemic shortcomings made worse by the pandemic, and some argue the government of Ontario Premier Doug Ford.
We may reach a point of no return.
Nursing associations point to deteriorating working conditions and Bill 124, Ford government legislation that caps wage increases for nurses at 1%.
They are more and more exhausted, and they don't see the help coming.
Ontario's Health Minister Sylvia Jones declined a CBC News interview request. In a statement, her office wrote, "Since the start of the pandemic, we've added more than 10,500 healthcare workers." But the province's efforts have seemingly done little to stop this emergency.
You know, it makes me wonder if our politicians' family members were in those beds. I wonder if things would change.
Judy Stewart recently spent 12 hours in an Ottawa ER with a broken ankle.
The nursing staff were literally running at times. They were literally running.
That pressure is a day in the life of Chogala.
It's not easy. We're just trying to take one step at a time.
Ellen Morrow, CBC News, Toronto.